Hello, everyone. My name is Matthew Tuller, and today we'll be talking about the nutrition assessment and intervention plan for Jane. Today's presentation will focus on a comprehensive case study involving Jane, a 14-year-old adolescent recently classified in the obese BMI category. In the next several minutes, we'll walk through multiple facets of her current health status, including a detailed review of her anthropometric measurements, recent laboratory findings, and results from our dietary assessment. We will also explore contributing social and environmental influences that impact her food choices and dietary patterns. The discussion will conclude with an in-depth look at a proposed nutrition intervention plan that is practical, realistic, and family-centered. Overall, the goal is to illustrate how structured and supportive nutrition interventions implemented early in adolescence can help prevent the progression of obesity and reduce long-term metabolic complications. So Jane has experienced steady and significant weight gain over the past 6 years, averaging approximately 10 to 15 pounds per year, which is substantially above what is considered normal for healthy adolescent growth. In addition, in this concerning weight trajectory, her recent laboratory work indicates early metabolic abnormalities, such as elevated fasting glucose and reduced HDL cholesterol. These values suggest the beginning stages of insulin resistance and cardiovascular disease risk. Taken together, these findings highlight the need for a targeted and timely nutritional intervention. The purpose of this presentation is to provide a comprehensive overview of Jane's current health status and identify both modifiable and non-modifiable risk factors contributing to her obesity. We will outline an actionable, family-centered plan that addresses dietary intake, lifestyle behaviors, and the broader social context in order to improve her health and long-term outcomes. So for Jane's anthropometric overview, Jane is currently has a BMI of 27.96, which places her above the 95th percentile for her age according to the CDC growth charts and classifies her as obese. Her height plots at approximately the 50th percentile, while her weight is the 95th percentile, indicating a significant imbalance between linear growth and body mass. This disproportionate increase in adipocity at a young age is concerning, as data indicates that around 80% of obese adolescents will remain obese as adults. The implications of this excessive adipocity are far-reaching. Early onset obesity is frequently associated with the development of metabolic syndrome, type 2 diabetes, hypertension, and cardiovascular disease later in life. Identifying and addressing these trends at this stage allows healthcare providers to intervene while meaningful and long-lasting changes can still be achieved. As for Jane's laboratory results, they provide further evidence of early metabolic dysfunction. Her fasting glucose is currently 116 milligrams per DL, placing her in the pre-diabetic range, indicating impaired fasting glucose, a warning sign of developing insulin resistance. In addition, her HDL cholesterol level is 36, which is low and is below the recommended threshold for adolescent females and decreases her level of cardiovascular protection. Her LDL cholesterol is 113, which is considered borderline high and can contribute to atherosclerotic changes over time if left unchanged. Even though she is not yet experiencing physical symptoms, these abnormal markers of dyslipidemia and glucose regulation reflect underlying metabolic stress that require immediate attention. When evaluating alongside her weight trajectory, these lab values reinforce the urgency of implementing both dietary and lifestyle interventions as soon as possible. An evaluation of Jane's 3-day food record reveals a daily caloric intake ranging from approximately 2,700 to 3,000 calories per day, well above the recommended 1,800 to 2,200 calories for a sedentary adolescent female. Her diet is dominated by frequent consumption of sugar-sweetened beverages, fried foods, processed snacks, and fast food meals, and contains minimal amounts of fruit, vegetables, whole grains, and low-fat dairy. The excessive intake of saturated fat, added sugars, and sodium contributes to the poor nutrition quality and places unnecessary strain on her cardiovascular and metabolic systems. At the same time, she demonstrates key nutrient deficiencies, including inadequate fiber, calcium, vitamin D, and iron, which are important and almost essential for growth, bone health, and gastrointestinal function. These dietary patterns reflect both the influence of her household food environment and broader challenges related to time, convenience, and costs. So there are some key nutrition concerns and contributing factors to Jane's current health status, which is influenced by a combination of genetic and environmental factors. Her family has a history of obesity, hyperlipidemia, and type 2 diabetes, which increases her genetic predisposition to these conditions and places her at a higher long-term risk. However, environmental influences within the home are particularly significant and importantly modifiable. The family experiences food insecurity, which often results in reliance on inexpensive, calorie-dense foods in order to stay within budget. Additionally, there is limited nutrition knowledge and minimal modeling of healthy dietary behaviors at home, which can reinforce unhealthy habits. Time constraints and frequent consumption of convenience and fast food contribute further to poor diet quality. Recognizing and addressing these contributing factors is essential for designing an intervention that can realistically be carried out. So some supporting evidence that was found, research has consistently shown that social determinants of health play a critical role in the development and progression of obesity and metabolic risk. In one study by Harrison et al., there was a 4.1% increase in prediabetes prevalence among children experiencing adverse social determinants such as food insecurity and lack of access to safe recreational environments. Additionally, several large-scale cohort studies have demonstrated that high consumption of ultra-processed foods is strongly associated with increased body mass index, waist circumference, and total adiposity in children and adolescents. These findings emphasize that sustainable intervention strategies must go beyond simple dietary advice and instead consider both behavioral and environmental determinants. Without addressing the broader context, improvements in diet are unlikely to be maintained over time. So the goals of intervention for Jane, the primary goals of Jane's nutrition intervention are to support healthy linear growth without further excessive weight gain, improve overall diet quality, correct nutrient deficiencies, and promote sustainable lifestyle behaviors. Rather than focus solely on weight loss, the emphasis is on creating long-term healthy habits and stabilizing her weight trajectory. The intervention is designed to be family-centered as a caregiver involvement in meal planning, nutrition, education, and behavior change leads to much higher success rates. Engaging the family as a unit allows the intervention to address both environmental barriers and day-to-day behaviors simultaneously, creating a more supportive environment for Jane. Now, there are some recommendations for Jane. Uh, Behavior changes: swap sugary drinks for water or milk, limit fast food to once per week, plan simple home prepared meals. These dietary recommendations for Jane focus on gradual, achievable, and sustainable changes. The family is encouraged to reduce, again, her intake of sugar sweetened beverages, fried foods, and processed snacks while progressively increasing the consumption of fruits, vegetables, whole grains, and lean proteins. Affordable, nutrient-dense substitutions such as beans, oats, frozen vegetables, canned tuna, and eggs are highlighted as budget-friendly options that still provide essential nutrients and promote satiety. This approach helps balance caloric intake and improve nutrient density without increasing financial burden. And arguably most importantly, nutrition education remains a critical component of the intervention. The family will receive guidance on portion control, reading nutrition labels, and using MyPlate visuals to build balanced meals. Structured meal plans and grocery shopping lists will make meal preparation easier and reduce reliance on convenience foods. Emphasis will also be placed on budget-friendly strategies, demonstrating that healthy eating is possible even with financial constraints. Now, there's a 3-day sample meal plan. The proposed 3-day meal plan offers practical, balanced, and affordable meal ideas tailored to the family's preferences and financial limitations. Examples for breakfast include scrambled eggs with whole wheat toast and fruit, or oatmeal topped with flaxseed and banana. Lunch options include turkey or mixed bean wraps with vegetable and fruit, providing a combination of lean protein and fiber. Dinner suggestions include baked chicken or salmon prepared with brown rice, quinoa, or whole grain pasta, along with steamed or roasted vegetables. Snack options can include low-fat yogurt, unsalted nuts, air pop popcorn, and fresh fruit. These meals are designed not only to stabilize caloric intake and improve nutrient quality, but to demonstrate that simple, home-prepared meals can be both healthy and affordable. Again, here's another sample day of what a typical day for Jane eating could look like. Again, there's plenty of options that are nutrient dense, and the amount of options is limitless. Again, here's day 3. So, in conclusion, Jane's case highlights the multifactorial nature of adolescence obesity, which is shaped by genetic predisposition, dietary behavior, and environmental factors. Early, structured, and family-centered interventions are essential in preventing the progression towards chronic metabolic disease. By combining target dietary recommendations with practical nutrition education and connection to the community resources, this intervention empowers the family to implement meaningful and sustainable life changes. Intervening at this stage of development provides a critical opportunity to improve Jane's nutrient intake, stabilize her weight trajectory, and ultimately reduce her long-term risk for cardiovascular and metabolic complications. So the expected outcomes of Jane, um, working with these nutrient, dietary, behavioral, and environmental interventions, is stabilizing her weight trajectory, improving her nutrient intake, especially fiber, calcium, vitamin D, and iron, lower intake of added sugars and saturated fats and ultra-processed foods, reduce her risk of type 2 diabetes and cardiovascular disease, increase food security through education and resources, and improved family cooking and meal planning. And these are the references. Thank you for your time today.